can a woman personally examine herself? You know, what are some of the things she can do just when she notices that she's experiencing difficulty, you know, getting pregnant? What are some of the things she can do all by herself?
Now, I always counsel women when they come to my clinic. And I've discovered that women are always shy of examining their bodies. I don't know why. Because there are times when you get to the hospital, when we say, Madam, have you observed this? And say, I never know. Some is even their husband, caring husband. Men can also be very wonderful.
Oh, that's nice. Thank God for the wonderful men around us.
I've discovered that something is wrong. A woman should examine her breast. Like I talk about milky breast.
Right.
There are clients that will come to the hospital and say, is there any discharge from your breast? They will say no. By the time we examine, some is even like River Niger. The thing will jet out like milk. I said, this is that I say I never know. And regarding fibroid, some will have fibroid that is as big as 8, 7, 9 months pregnant, and they will tell me, I just discovered a month ago. That cannot be true.
Can one discover fibroid by his or herself? Is it something? Oh, really?
One of the common symptoms of fibroid is abdominal swelling, swelling your tummy.
Okay.
So a woman that regularly lie down, examines her tummy, can discover that there's an abnormal swelling in my tummy. Okay. And can now raise alarm, go to the hospital. Or if you don't want, you are married, it's your husband, your husband can help you to examine your body. So women should examine their breasts, not only for milky or watery discharge, for lumps too.
Okay.
What we call self-breast examination. The best time usually the week after your menses, because a lot of women during menses, their breasts are tender and painful.
Okay.
They might not be able, they might not want to examine. The week after, stand in front of the mirror, compare the two breasts, check for water, any discharge, whether it's water or blood stain, check for lumps in the 4 quarters of the breast. So these are some of basic self-examination you can do regarding fertility. And also check your weight.
Okay.
Now, later we may talk about, because weight also has a bearing on fertility. We discover, not always, that women that have PCOS, quite a number of them are overweight or obese. So, you know, when you are not checking that's the way you know whether you are overweight or obese. You use your weight and height, you calculate your body mass index, and that will give you an idea. So these are some basic self-examination you can do.
All right, so since we're talking about infertility, so let's look at being fertile, or when a woman discovers that, okay, she's having difficulty getting pregnant, or a couple rather, as you said earlier, that when a couple discovers that they're finding it difficult getting pregnant, what are some of the things, some other things they can do, apart from checking themselves, doing regular examinations? Now they have done all of that. Is there any kind of particular food they need to eat? Is there any kind of exercise? You know, when a woman is trusting God, just tell her, what can I do? Do I need to abstain from certain things, you know? So what do you advise this couple to do?
Now, generally speaking, because the pregnancy will not occur in vacuum. The pregnancy, the woman is the vehicle, the receptacle to carry. So the general well-being of the woman and the man is the first consideration. Because if the woman is not even healthy and she conceives, she can even lose the pregnancy. There have been a lot of women that are like, their challenge is not conceiving, but retaining the pregnancy. So the first thing that the woman should ensure she maintains a very good state of health. General body exercise to keep fit and to prevent obesity and not being overweight. Balanced diet, because the first thing, like this, generally say health is wealth. You must first be in a very good state of health to be able to carry the pregnancy and even maintain it and carry it to term. When I say term, to 9 months, to viability. Now, the woman should enjoy balanced diet, fruits and vegetables, junks, and our generation is very fond of junks. Junks gives unnecessary calorie that makes it difficult to lose weight. And junks also increase the likelihood of having diabetes and some other challenges later. So it's good not only for the woman, because if the man, though the man is not the one that will be pregnant, but he needs to be in good health to give good psychological support, financial support, biological support to the wife. So maintaining good state of health is even the first step in a fertility treatment. Secondly, it's also very important that people seek help on time. I've seen couples that have been having fertility for 5, 6, 7, 8 years. They have not gone to see a gynecologist. And some have had instances that within few months and to a year of intervention, they conceive. But the way they have not taken, deemed it necessary to go and see a gynecologist, they should go to the hospital. But not only the woman, the couple. Because, and I want to still emphasize this, a lot of time men believe they are okay, and it's a lie. It's a very big lie. So
how do we convince men to actually buy this truth?
Now, this is one of the way of convincing them. I hope men that are listening to us will be convinced now.
Yeah.
Because I've seen several instances. I've even seen men already harassing their partner that those who are not Christian, I'm going to marry another wife, I'm going to go out because... And when they come to the infertility clinic, and we investigate them, we discover that the woman is perfectly all right. The problem is demand. So those who are very reasonable, they become sober. That how this way have been harassing the woman and the cause of the problem. So men should realize that infertility is a couple problem. Because generally speaking, 30% of the causes of infertility is from the man. Another 30% that roughly thought is from the woman. Another thought is from both of them. And there are instances that about 10 to 15% we are not really sure of the cause. Now we call it unexplained infertility. And this might be because there's limitation to investigation that could be done, or the center is being done. But there are times that even the best of centers, you might not be able to really explain accurately the cause of the infertility. So men should know that infertility, or this African mentality, has delayed a lot of couples from having their babies on time. So the couple that are facing challenge with infertility should go to the hospital and see the right expert. They should look for a gynecologist who will properly assess them and offer them advice. You know, doctor, when you said earlier that most times the man feels he's just okay, that the problem could just be the woman, and that leads to a lot of trauma and mental depression. And you talked about earlier that the woman needs to be in the right state of mind to actually, get pregnant. So how can a woman handle that state where there's pressure from her husband, there's pressure from her in-laws, there is pressure from her friends, thinking you haven't done enough, or there are things you need to do that you haven't done? How can she manage that state of mind, that season of her life, just in case she's going through that? Generally speaking, I have learned and discovered that, just like the Bible says that a merry heart doeth good like medicine. Doctor, it's not easy to marry you. I understand. In that state. I perfectly understand. I see them a lot. But one thing I usually tell the woman first is, you are the best architect of your own happiness. Apart from God, you are next. Because even our Lord Jesus Christ told us that in the world, we will face tribulation. But be of good cheer. I have overcome the world. So the woman herself must first know they should stop seeking approval from external body. They should stop seeking validation from external body. Yes. They should first and foremost know they are perfectly and wonderfully made. They should first be happy with it, irrespective of the infertility challenges. Then the next important point is their partner. Now, because I'm also an African man, I have learned that in tackling in-laws and external body, the man is the most important factor. Because by virtue of our cultural practices, there's a limit to which the woman can talk to the in-law. But if you have a mature and understanding man, the man is easier to silence troublesome and intrusive in-laws. And that is also important. There's a limit to which they do discuss details of their challenges with families. Because not all families that really have a neutral, there are wonderful mother-in-laws. I've seen wonderful mother-in-laws and father-in-law that are not even encouraging their daughter-in-laws that have challenges. Then aside that, the woman too should seek help, medical help, psychosocial help from right sources. Because some people have ended up injuring themselves by going to wrong sources for help. All right. I've just been signaled that we need to go on a quick break. So when we come back from this break, let's look at other options available in managing infertility. Probably look at IVF, we look at adoption, we look at what your take is on that and how best to go about that option. All right.